Hi everyone, welcome to Health Sachet. This is Madhur Kothare with another video that will help you and your loved ones have a healthy and happy normal life. In this video, I'm going to address a somber topic of depression. I'll specifically address a question: is depression treatable? I'll also cover various options available to you in different stages or types of depression. As a summary, in 80 to 90% of the cases, depression is treatable, and almost everyone will benefit with some of the ideas, techniques, or topics discussed in this video. By the end of this video, if you appreciate what I'm doing, show your support by subscribing to this channel and tapping the like button. So let's begin this video. To start with, you will need to know if you really have depression, because there are many other medical conditions which have similar symptoms to depression. Then you need to know the type of depression you have, because there are many flavors of depression. After that, you need to know how severe your depression is. Is it mild, moderate, or severe? Because depending on that, your treatment options change. Finally, you will need to know how long you should take treatment before you start seeing any difference, and for what duration you should be taking them. Remember, depression is a serious medical condition and you should seek doctor's help as soon as possible. This video is not a medical advice. This is to make you a little more informed about your treatment options so that you don't make some simple mistakes, such as stopping your treatment too soon if you don't see effects in certain time, or discontinuing your treatment just because your symptoms subside. And to that effect, I have written a detailed blog on my website, the link to which is given in the description below. Depression is a common medical condition which makes you feel, think, and act in negative manner. It can make you feel sad and even cause you lose interest in activities that you enjoyed earlier. The medical term for depression is major depressive disorder or clinical depression. In fact, 6% of the people have this problem in any given year, and nearly 15% of the people have it at least sometime during their lifetime. Obviously, some people get it multiple times and over multiple years. Curing versus treating. Before we dive deep into this subject of depression, let me clarify this issue about curing versus treating depression. Curing means once you address the problem, it goes away permanently, just like your fever. Unfortunately, at this stage, science is not able to cure depression permanently. However, with the help of proper medications, supplementation, dietary and lifestyle changes, you can keep the symptoms of depression away, probably for the rest of your life. So you can live a long and healthy life without any of those symptoms hampering the quality of your life. To me, that is complete recovery, if not cure. Symptoms and diagnosis of depression. Now, here are some symptoms of depression. Keep in mind though that some of them will also be seen in some other conditions, such as underactive or hypothyroid, vitamin B12 deficiency, and in rare cases, even a tumor. To make a confirmed diagnosis of depression, you need to see at least 5 of the following symptoms every single day for nearly 2 weeks, and they should be bad enough so that they hamper your normal life. Only then you can confirm the diagnosis of depression. Here are some of those possible symptoms. You may feel sad or down. In case of children or adolescents, they are more irritable than downcast. You may lose interest in activities that you enjoyed earlier. On the physical level, you may have trouble sleeping, or on the other side of the spectrum, you may even sleep too much. Nearly 90% of the depressed individuals face this. You may sense increased levels of fatigue or lack of energy. You may lose appetite and weight. Some people end up doing random hand movements, become restless, or even pace the room. They may become irritated or agitated easily. On the other hand, they may become withdrawn and walk slowly as if they are carrying a heavy burden on their shoulders. On mental side, they may not be able to focus on their work, think clearly, or make quick decisions. Note that these are to be observed in relation to earlier status of the person. If someone always talks slowly or dilly-dallied, you cannot term it as depression. A dangerous sign, especially in adolescents and youth, are thoughts of suicide. Seek medical help without wasting time in such cases. What is not depression? Feeling low for a long time is not necessarily depression. Even I have felt low during COVID times, but that is not depression. Feeling down can happen even in a normal individual. For example, if somebody loses a job, a relationship, or loss of a loved one can feel low. Feeling low in such times is normal and cannot be termed as depression. The way to distinguish such grief from depression is to check your feeling of self-worth. If you feel guilty, have self-hate, or you feel low on self-esteem, it is not grief, it is depression. Causes of depression. In our society, there is a lot of stigma attached to depression as if it's the person's fault. But there are many causes of depression, most of which don't depend on the person. Many of them are extrinsic to the person, just like fever is. And so you cannot term them as that person's fault. Let us look at the physical causes. There are brain chemicals called neurotransmitters that help different brain cells to communicate with one another. The main three involved in depression are serotonin, dopamine, and norepinephrine. They transmit different types of messages and so show different effects on our behavior. Serotonin affects mood, energy, appetite, and sleep. Dopamine controls motivation and pleasure. Norepinephrine regulates concentration, attention, and energy. All of these are depressed, unintended, in depressed people. However, science does not yet know why. On the genetic front, depression can run in families. A gene called SERT helps in serotonin transport. Families with a particular variation of this gene are more vulnerable to low levels of serotonin and depression. Someone who is low on self-esteem or is pessimistic by nature is more likely to have depression. There are environmental factors too. Some depressive people may have had long-term stress, possibly from neglect or abuse in childhood, social isolation, etc. Omega-3 fatty acids play a role in brain functioning. They affect mood and memory. Deficiency of omega-3 fatty acids can lead to depression. Vitamin D deficiency is linked to depression. Many depressed people were found to be deficient in vitamin B12, and people deficient in vitamin B9 don't respond to antidepressants, which are the medications for managing depression. Protein deficiency can cause mental fog. It may make you lack focus and depressed. Minerals such as iron, zinc, selenium, magnesium, chromium, and even iodine help in brain health and may help avert depression symptoms. Certain medical disorders such as Parkinson's syndrome, heart disease, or even some cancers are known to be associated with depression. Finally, certain class of medicines such as blood pressure lowering medicines or cholesterol controlled medicines may also lead to depression. Types of depression. There are many types of depression besides the most commonly observed one. Here are two of them which you should know. One is called seasonal affective disorder or SAD. It comes to people during winters when nights are very long in some of the regions. And so this depression comes around the same time of the year and it disappears when spring comes, when the nights become shorter. Another type of depression is called dysthymia or persistent depression disorder. This has much milder symptoms of depression but for a very long time, such as say 2 years or more. Treatment of depression. There are 6 pillars of management of depression once the diagnosis of depression is made. Medicines, dietary and nutritional changes, lifestyle changes, behavioral therapy, device-based management, and complementary therapies. Medicinal treatment. Since low levels of serotonin, dopamine, and norepinephrine are common in depression, medicines typically try to elevate the levels of these. Keep in mind that since these managements are temporary, you may have to take these medicines for life or for whatever period your doctor advises. The first line of treatment is a class of medicines called SSRI. They lift your mood by raising serotonin levels in the brain. Medicines called SNRI are used at the next level. They raise serotonin as well as norepinephrine. Earlier, a class of medicines called tricyclic antidepressants or TCAs were used. These days, they are used if other types of medicines don't seem to work. Another class of medicines are MAO inhibitors. They are the oldest class and have many side effects. But if the other medicines don't work, doctors prescribe them. And then there are some other atypical medicines that address specific symptoms of depression. 5 points about these medicines. You have to take the antidepressants every day, not just the days you feel depressed. You should not stop them when the symptoms disappear. They will not make the symptoms go away permanently. So you run a risk of your depression returning. Antidepressants may take at least 3 months before you see the effects. So don't prejudge if the medicine is working. That is for your doctor to decide. You can take these medicines lifelong, though in some cases you may not need to take them after a long time. Finally, if you want to stop taking the antidepressants for whatever reason, don't stop them abruptly. Talk to your doctor, who may help you gradually reduce the dose. Else, you may get withdrawal symptoms also. Dietary and nutritional changes. In dietary and nutritional changes, here are some tips for you. Stress is a trigger for depression. Control your stress by drinking a lot of water, reducing caffeine and alcohol intake, stopping smoking, and by eating healthy food. When it comes to nutrition and supplementation, here are some vital points to keep in mind. Make sure you do not have deficiencies of protein, vitamin D, B vitamins, especially B12 and B9. Similarly, take sufficient levels of minerals such as iron, zinc, selenium, magnesium, chromium, and iodine. A good idea will be to take all these minerals through a good natural source multimineral supplement. Why natural? Because the bioavailability, or roughly the absorption into your blood, is much higher for natural source minerals than chemically sourced ones. Even ginkgo biloba, saffron, and something called St. John's wort is found to be useful in management of symptoms of depression. Lifestyle changes. Amongst lifestyle changes, exercise is found to help in depression. Try to get at least 3 hours of exercise in a week. Being outdoors helps you get a better connect with the world, such as what I'm doing right now. Breeze, scenery, and people may help improve the symptoms of depression. As mentioned earlier, stress can trigger depression. So you can control it by taking adequate amount of sleep, using yoga or mindfulness, such techniques, and increase your interaction with your friends, family members, and social groups. Behavioral therapies. Regarding behavioral therapies, here are your options. Cognitive behavioral therapy, or CBT, which teaches you to identify and reframe your thoughts and behavioral patterns that are common in depression. The patients learn to change their thoughts and actions to improve their emotions. Interpersonal therapy, or IPT, teaches the patient to improve communication and interpersonal interactions. It goes on for 3 to 4 months typically. A typical therapy helps people identify something called thinking traps, which make people think in a particular pattern of thinking. The idea is to identify them and then try to break them. The goal of the therapies is to teach you how to do that in various situations. Device-based therapies. If the depression symptoms persist for a year or longer, or if the depression symptoms are extremely strong, certain device-based therapies may be used. They involve brain stimulation in some ways. Transcranial magnetic stimulation, or TMS, which stimulates the nerves in the brain to increase brain activity. Electroconvulsive therapy, or ECT, which involves small electric shocks given under sedation to brain to restore this normal brain activity. Vagus nerve stimulation, which involves implanting a device in chest and aim to raise the levels of neurotransmitters in the brain. Complementary and alternative therapies. There are many complementary and alternative therapies that can be used in depression, but make sure you don't use them exclusively. Talk to your doctor before you add them to your repertoire. Here are some of them: acupuncture, music therapy, yoga, meditation and mindfulness, massage, reflexology, and guided imagery. In summary, you have a whole host of options available to you if you are diagnosed with depression. Be patient, be trusting, and seek medical help as soon as possible. Don't think you are less of a person just because you are diagnosed with depression. Just as a diabetic has blood glucose disorder, or you can say, I have a eye accommodation problem, I need glasses or spectacles, you have a brain neurotransmitter disorder if you are having depression. So don't be ashamed of your problem. With proper treatment, you can live a perfectly normal and healthy life. Here are some more videos on this subject. Remember, ignorance is a very bad idea when it comes to staying away from a lifetime of depression. Thank you.